The Vaccine Advisory Committee was organized to tackle the difficult decision of who should come next for the COVID-19 vaccine. The 27-person committee voted to recommend that a group of around 1.2 million Oregonians be next in line.
This disease has had a very unequal impact. So I think when we look to vaccine, even though all of us are eager for it, we have to take equity into consideration.
Dr. Jim Shames with the Jackson County Public Health says using equity as a lens to guide the rollout is a smart decision. But he says it's difficult to imagine vaccinating that many people with the uncertain stream of vaccines they're getting.
They're moving slowly, they're moving quickly. It's hard for us to make large scale plans when we just aren't sure how much vaccine, which vaccine, when's it going to come, and who's going to get it.
In Josephine County, Dr. David Candelaria says they are more worried about the upcoming vaccinations of senior groups.
Not only because those are much larger populations than this pretty closely defined phase 1A, but we still don't really have a good sense that vaccine supply is going to be able to arrive to help us meet those populations in a timely fashion.
He says he feels the state's quick announcements of who is next is even complicating the existing vaccination process.
But because the vaccine's in short supply, such short supply, other ideas come up like, well, maybe we should delay the second vaccine and just give more people the primary vaccine. Or should we prioritize the second vaccine and not give a primary vaccine to people who are otherwise eligible?
The advisory committee's next group suggestions includes people aged 16 to 64 with pre-existing conditions, frontline essential workers, people in custody, and people living in low-income housing.
We've talked about that since the very beginning, that the vulnerable people who might really have the most difficulty coming through COVID in a positive way, that they need to be prioritized.
Klamath County Public Health's Valerie Lane agrees vulnerable populations should be prioritized, but has the same concerns about vaccine supply. She says they have about 5,000 eligible seniors to vaccinate next month, but the vaccines just aren't there.
And we haven't had 5,000 doses of vaccine in the community all at once.
All three county health officials are asking for people's patience and understanding.
It feels like the state is saying, you're eligible to get a vaccine, call public health, and public health is kind of stuck by saying, but we don't have any vaccine.
Hope is that people can be patient with us and understand that we are trying to serve them in a prioritized way.
The whole COVID outbreak has really pointed out inequities in our healthcare system and in our country.
Grace Smith, NBC5 News.